Good morning. Welcome to another edition of Riding in Cars with Researchers. Today I want to talk to you about placebo. There are a lot of misperceptions around placebo. Today there's one point. Today's point is, if we should be treating you with something and we don't, it's unethical and malpractice. Placebo. If we're using a placebo, if you're randomized to placebo, but we should be treating you with something else, and we don't, it's unethical, it's determined as unethical around the international community, and it's malpractice. Okay, so how is it that placebos are sometimes used in clinical trials? Because that's where the misperception stems. People think that, wow, maybe I should be on something and I could be randomized to placebo. That's really scary and it sounds unethical. Okay, there's two ways that happens. Way number one is more simple. The standard in research today is double-blind, meaning that you don't know what you got randomized to, and I don't know what you got randomized to. And that's so that we're not able to introduce bias into the study. If I know what you got randomized to, I may actually treat you a little bit differently, maybe subconsciously, but I may treat you differently, and that actually bleeds into the data. That becomes an influence to what the data looks like. And so we want to minimize that as much as possible. That's why we do double blind. Okay, now let's make up a study where we're using pills. 2 antibiotics. One antibiotic is a small white pill. One antibiotic is a large blue pill. In order to maintain the blind, we do what's called a double dummy. There are 2 placebos. So there'll be an active small white antibiotic and a placebo small white antibiotic, and an active large blue antibiotic and a placebo large blue antibiotic. And if you're randomized to the active white antibiotic, you will also receive a placebo blue. And if you're randomized to the active blue, you will also receive a placebo white. So there's a study with 2 placebos, but nobody only gets placebo. Everyone is getting what's believed to be an active therapy. But you'll see placebo in the title of that study. That's why. No one is randomized to only placebo, because with antibiotics, it would be unethical for you to have an infection and for us to not treat you. Point number 1. Sometimes we use placebo only to maintain the blind, but in fact no one is only on placebo. The second way placebos are used is when there is no comparator. So if I invent the cure to cancer today, there is no cure to cancer. There's nothing for me to compare it to. And there are examples of things today where there's nothing to compare it to. In non-alcoholic steatohepatitis, it's an active area of research today, and there's nothing to compare it to. And so in those trials, patients can be randomized to placebo because there's no ability to have a comparator. Nothing else exists. So the second way we end up with placebo is when there's nothing else to compare to. And here's the third and final way that we have placebo. The third and final way we have placebo is when the standard of care is not to treat. Simple acne, for example. Most acne patients don't receive any therapy. Most acne patients wash their face and take care of their face and don't touch their face, and that is the standard of care. And so if we designed a trial where everyone who goes into the trial is guaranteed to be on antibiotic, we would actually be over-treating some patients. We would be exposing some patients to potential side effects who in normal standard of care healthcare would not have been on antibiotics. That's the third way that we sometimes use placebo, is when the standard of care, the normal healthcare, is not to put somebody on something. And so in those cases, the patient would be randomized to standard of care versus the study medication. Those are your 3 ways that we use placebo today. The fundamental point, though, is if we should be treating you with something, we will. It is unethical not to. It is malpractice not to. If something changes in the midst of the trial, we will let you know and change course midstream. Thank you for following along with Riding in Cars with Researchers. Enjoy your day.